Muted.
Hey, welcome all, and thank you for joining us today for DSCSA Grandfathering and the Effects to Your Business webinar and regulatory update. Now, before we get started, we would like to review just a few housekeeping items. This webinar is intended to be interactive. Please keep an eye out for interactive polls and click directly on your screen to submit responses. Feel free to share your questions throughout the webinar using the GoToWebinar questions box in the right-hand side of your pane. Please note that information contained in this document is currently as of October 2016. This information is provided as is, and you are encouraged to confirm this information with national regulators before making decisions related to compliance. We would love for you to join us for future webinars. To register and view upcoming webinars, visit systech1.com/webinars. And finally, we value your feedback regarding this webinar, would like to improve future webinars to better serve you. At the end of this session, a short survey will appear for you to complete. We do appreciate your feedback. Without further ado, I'd like to present your presenter for today, Mr. Dirk Rodgers, a regulatory strategist with Systech. Dirk is a well-known global expert on the current and emerging set of pharmaceutical regulations in serialization and traceability, and is the founder of rxtrace.com. Dirk, please take it away.
Thanks, Mirov, and welcome everyone. For just a few words about Systech right at the beginning here, most of you are already aware that we have been in business for 30 years now, and we are the only one company to deliver serialization, track and trace, authentication, and engagement systems that meet all known regulations around the globe. One of my roles here is to help keep our solutions up to date as regulations change. We are the proven innovator in our field. Definitely consider us the next time you need a system that meets regulatory and business requirements and beyond. Okay, this is a quarterly update on the global pharma serialization and tracing regulations, but I also want to cover the topic of grandfathering under the U.S. Drug Supply Chain Security Act. So here's our agenda. I'm going to start out with that topic and then switch over to talk about the things that have happened since our last regulatory update webinar back in April. I have an update for China, Brazil, the US, and India. And then I'll give you an update on some of the pending regulations. Before we talk about grandfathering in a DSCSA sense, I wanted to explain what the term usually means, so we're all on the same page. Black's Law Dictionary defines grandfather clause as an exception to a restriction that allows all those already doing something to continue doing it, even if they would be stopped by the new restriction. So this assumes that something is already being done when a new restriction would normally put a stop to that thing. The grandfather clause provides a specific exception to that new restriction for those that are already doing that thing, at least for some period of time. And typically, grandfather clauses are time limited. That is, the exception only lasts for some specific period of time, or while some time-limited condition exists. So in a DSCSA context, it might mean something like this. Drug manufacturers may be able to continue supplying non-serialized drugs even after the November 27, 2017 hard deadline defined in the DSCSA, as long as something happened to those drugs prior to that deadline. In this case, the time that this exception would exist would be determined by how long it takes each drug manufacturer to sell off their supply of non-serialized drugs that meet the specific grandfathering criteria. But this is just a hypothetical grandfathering clause. The reason it is only hypothetical is that the FDA has not yet fulfilled their obligation to provide the exact wording of this important grandfathering clause. Here's what the DSCSA law says about grandfathering of drug manufacturers. Not later than November 27, 2015, the FDA shall finalize guidance specifying whether and under what circumstances product that is not labeled with a product identifier and that is in the pharmaceutical supply chain at the time of the effective date of the requirements of this section shall be exempted from the requirements of this section. This refers to the final guidance that we are currently waiting for the FDA to provide. So what options does the FDA have for their guidance? In theory, according to the section of the DSCSA we just looked at, the FDA could prohibit grandfathering altogether, but I don't think they will do that. Odds are they will choose to define the phrase products in the pharma supply chain on November 27, 2017 as either products manufactured prior to that date, products packaged prior to that date, products sold by the manufacturer prior to that date, or products shipped by the manufacturer prior to that date. If they choose the last one in this list, that would be the same as prohibiting all grandfathering, because those are the only units that will already be out of the manufacturer's control on November 27th of 2017. So there would be nothing the manufacturer could do with those products anyway. So A, B, or C are the most likely. So that's my opinion, but let's take a poll and see what you think. So we should be seeing a poll. Here we go. Which of the 4 options do you prefer? Products manufactured prior to that date, products packaged prior to that date, products sold by the manufacturer prior to that date, or products shipped by the manufacturer prior to that date? So go ahead and select one of those. We'll give you a minute here while we collect the results. All right.
Feel free to click directly on your screen to make your selection. We're about 50% voted, climbing quickly. Give another 5 seconds. All right, let's see what everybody says.
Yeah, that's not a surprise. Products manufactured on that date, prior to that date, because that would give you the maximum flexibility. And so we see the decreasing from there for packaging and sold. So very interesting results. All right, so here's what the DSCSA says the manufacturer must do beginning no later than that date. Affix or imprint a product identifier to each package in a homogeneous case of a product intended to be introduced in a transaction into commerce. Without a grandfathering clause, this clause is very confusing. What exactly constitutes a product intended to be introduced in a transaction into commerce? Here are a few things to consider. Drugs sitting in the manufacturer's distribution center or their 3PL's warehouse have not yet been introduced into commerce because they have not yet been the subject of a DSCSA transaction. So these drugs could reasonably be considered intended to be introduced in a transaction into commerce. Following that line of logic, these products would need to have the DSCSA product identifier on them on the effective date and therefore would not qualify for the grandfathering provision. But Congress didn't really say that. They left it up to the FDA to tell us in their guidance. And remember, Congress intended that question to have been resolved last Thanksgiving. All right, time for another poll. If allowed, when do you believe the FDA grandfather exception will begin? So select one of these, November of this year, November of next year, November of 2018, or November of 2019. Give you a minute to
Okay, steadily climbing. About 50% voted. Give another 5 seconds. 4, 3, 2, 1. Let's share these results.
Very good. The largest 79% said November of next year, and that's exactly right. That's the beginning of when the grandfathering would actually take place. Here are some of the implications of potential DSCSA grandfathering. If allowed, the grandfather exemption would begin on November 27th, 2017. That much is pretty clear. It would likely end on November 27th of 2019 because that's when the DSCSA prohibits wholesale distributors from buying non-serialized drugs. Over that period of time, the number of non-serialized drugs in the supply chain would naturally decline because the supply chain would naturally consume most, if not all, of the inventory of non-serialized drugs that were the subject of the grandfathering clause. The question is, what happens to those few drug products where the inventory of non-serialized drugs on the effective date is more than the supply chain can naturally consume prior to the wholesaler's date in 2019? Will the FDA grandfather guidance extend grandfathering to the wholesale distributors or even to the dispensers? We'll just have to wait and see. Back at the GS1 Connect conference in early June of this year, Dr. Connie Jung of the FDA said that she expected their grandfathering guidance to be published, quote, soon. But unfortunately, there is probably a long approval cycle for anything the FDA publishes, and this guidance is probably stuck in the middle of it, along with the other FDA DSCSA guidance documents that are overdue right now. If you have any questions about grandfathering, please feel free to enter into the GoToMeeting questions box, and I will either answer it later in this session or in an email to you later. All right, now for the regulatory updates. First is China. As everyone is probably well aware, the original pharma serialization and tracing regulation has been in effect for a number of years, but earlier this year it was suspended. We can only speculate on the reason that they took that drastic action, but I know that there is a lawsuit by members of the domestic industry just prior to the suspension. The old system was non-standard and inefficient as a result. During the summer, an unofficially translated draft outline for the new law was circulated in the industry, and it offered a glimpse into some of the characteristics the government is considering for the replacement system. These include, it would have eliminated the government from the design and operation of the system. This would be a significant departure from the previous law because the whole thing was a government design and that was operated under a government contract. Instead, it appears that the industry would be expected to develop the data repositories. This might be similar to the EMVO, an industry-funded system of repositories necessary to meet the Falsified Medicines Directive in the EU. Many hope that this redesign offers a chance to redesign the system around global standards, particularly those offered by GS1. Here are the latest updates. Back in August, the China FDA published an update to their data quality management specification for drug manufacturers, and for the first time, they added multiple references to the serialization and tracing requirement. It contained no details, but this addition makes it clear that the suspension of the old law should not be taken to mean that the China government has abandoned pharma serialization and tracing. Rumors keep circulating in the industry that imply that the new China regulation will be published before the end of this year. There is no official word on that yet, but the frequency of these rumors coming from multiple sources make me think they are probably accurate. We'll just have to wait and see. Rumors also imply that the new regulation may use some GS1 standards. Until the regulation is published and is translated into English, we won't know how complete the government has embraced GS1. Brazil also suspended its original law late last year with the intention of creating a better one. The original law was so burdensome for manufacturers and importers that I wondered if it was even possible for it to become fully operational. Clearly, the outcry from the industry is why it was suspended. The Brazilian Congress took up the consideration of a new bill near the end of last year that would lead to an improved regulation, and we have word that it is likely to be fully enacted in just the next few weeks. The questions are, will it really be less burdensome, and will it more fully embrace GS1 standards? We'll have to see what gets enacted. That will require a good English translation before we can be fully confident. Over the summer, a draft of the law under consideration by the Congress was published, and it included the following time frame. 4 months for ANVISA to write regulations and publish them, and then 1 year for the same kind of 3-lot pilot that was suspended from RDC 54 last fall, then 8 months for analysis of the results of the pilot, then 3 years for all drugs to be serialized and traced. This timeline will be kicked off on the date of enactment of the new law. This seems like a more reasonable timeline than the old regulation established, although I'm not really sure it will satisfy everyone. Since our last Systech regulatory update webinar, a few things have happened related to the US DSCSA. But for me, the most notable things are the ones that did not happen. So far, none of the 4 guidance documents that were due last November have been published. But the things that did happen include the FDA held a DSCSA workshop in April to collect ideas from the industry on what they should include in their pilot that Congress mandated. They collected a very long list of things that the attendees felt might be tested in 1 or more pilots. No word on when a pilot might begin. As I said earlier, FDA Representative Dr. Connie Jung indicated in June that they were hoping to publish the FDA guidance for grandfathering, waivers, and exceptions sometimes soon. Odds are the FDA is not in control of when these guidances are published. My guess is that they're being reviewed by the Office of Management and Budget. As we've seen in the past, that process can be painfully slow, and it is totally opaque until they approve a document. In early August, the FDA published an updated version of their guidance agenda for calendar 2016, and it included 6 DSCSA draft guidance documents that they intend to publish this year. This included the 4 that are overdue, plus numbers 2 and 4 on this list. I can't wait to get each of these in my hands, but for now, we'll just have to wait. A few updates on pending regulations. The update for India is simply to inform everyone that Systech has opened a permanent office in Mumbai, and last week we held a Uniquity event there. We heard from several regulators, including Anis Chandra, Director, Ministry of Commerce and Industry, speaking on the DGFT export regulations, and Dr. Hemant Koshia, Commissioner, Food, Drug, and Cosmetics Administration of the state of Gujarat, speaking on their advanced monitoring program for illegitimate drugs in the supply chain. The event was well attended. Right now, we are waiting for any movement toward the enactment of a serialization and tracing regulation of the domestic pharma supply chain. From presentations and side conversations, I got the impression that the regulation is not imminent. I also got the impression that it will probably be some time before we see the DGFT impose the serialization requirement on the primary packaging for exported drugs. Today, serialization at that level is optional. For Pakistan, rumors are that the government is working on a serialization and tracing requirement for vaccines. For Russia, people have reported seeing a recent draft of the regulation that the government is working on. Rumors are that the pilot they have been planning would run the entire year of 2017. The results of the pilot would be published in February of 2018, and the final law may be published, may not be published until after that, so the results of the pilot can be incorporated into the design. Egypt is reportedly working on developing a database of master data for drugs marketed there. It would reportedly include photos of your packaging. You would be required to submit sample packaging so the government would be able to photograph it in a standard way. All right, now let's take another poll. Let's see, what do we have? Do you think these serialization regulations have reduced the threat of counterfeiting? Yes or no? What do you think? I'll give you a minute.
Once again, if you joined a little late, just click directly on your screen to vote. Give us another 10 seconds. 50% voted. All right. Close this poll and share these results.
A little bit of a mixed result, but I'm glad to see that the majority think that they have reduced the threat of counterfeiting, particularly in some countries. So very good. Okay, now I will hand it back over to Mirov so I can have a look at the questions that have been submitted, and then I'll get those back in a few minutes to answer them. Mirov?
Thank you, Dirk. Now, before we move on, please stick around for Q&A. We'll address as many questions as time allows. If you haven't had a chance to submit any questions, please use the questions box in the GoToWebinar pane on the right-hand side of your screen. For your convenience, a detailed webinar booklet in PDF form will be sent to you within the week. This will be accompanied by a recording of this webinar, which we're recording right now. To access the booklet and the webinar recording, other than by email within the week. As you receive that email, we should also be posting it on systech1.com/webinars. We do value your opinion, so please let us know how we did by completing a short survey once this webinar is concluded. And we'd love for you to join us for the next webinar on traceability and compliance, scheduled for November 2nd, 2016. Registration will be made available within a week and a half at systech1.com/webinars. Now I'll hand it over to Dirk for Q&A session.
All right. Thanks, Miroff. I've got a good number of questions here. Let me expand my window. Okay. So let's see. Other than the questions that Miroff just answered, do you know where Canadian regulations stand regarding serialization? Well, that's a good question. In fact, Canada currently does not have any requirement for serialization. I did speak at a GS1 meeting about a year ago, and all they were trying to do was to keep up to date on the global regulations to see, whether or not they should perhaps work with the government of Canada on developing one. But I've not seen any movement toward that since then. So far, nothing there. Any feedback, please, that the serialization regs in India may not be under the control of the DGFT in the future? Well, DGFT is just for exported drugs, and I suspect, I don't know why they would remove it from that organization, because they're specifically aimed at exporting a product. So I would be surprised at that, I guess. But the domestic supply chain, the regulations there would be under the Ministry of Industry and Commerce, I believe. There's a different focus on the domestic market there. So it would not be the DGFT for the interior of the country. Do CMO manufacturers have to track product between their internal warehouses before shipping to customers? My interpretation of that is no, they don't have to, because the DSCSA is really just requiring you to track or document transactions that happen in the supply chain between DSCSA manufacturers, wholesale distributors, and dispensers, and also repackagers. And so these internal movements, even between a CMO and a 3PL, or the original manufacturer and a 3PL, those don't have to be tracked according to the DSCSA. It'd be a good idea, I think, for you to keep track yourself, but it's not required by the law. Okay, can we ship products from U.S. facility to EU facility to apply serialization label and then introduce in the supply chain? So this would be a question for the Falsified Medicines Directive, where you've got products in a U.S. facility, and the question doesn't identify whether or not these are owned by the same entity, but I'm assuming they would be. And I don't believe these would require tracing. So as long as they're still in control of the manufacturer, it's okay to ship them from a facility that you own here in the U.S. to the EU and then apply the serialization at that time. That's my interpretation. So let's see. This is scrolled up here. So, do you believe grandfather will be allowed for manufacturers after November 27, 2017? Well, I'm not sure how to interpret that question, but I believe that whatever guidance the FDA provides to us, it will identify basically, obviously, how grandfathering will work. I don't think they're likely to allow you to continue to make product after that date that is not serialized. But it could go either way, unfortunately. We won't know until they give us that guidance. Okay, I'm going to do one more. I see we're approaching our end time. In other countries where serialization has been implemented, what's the typical % improvement of counterfeit reductions observed? I love this question. I don't know the answer to it. I wish Turkey would publish exactly this kind of evidence, not only for our own interests, but also for the interests of countries around the world. without that kind of evidence, it's really hard to know whether the cost that's being invested in these systems justifies what's coming out. I suspect Turkey probably has been very successful, not only in blocking counterfeit drugs, but also reimbursement fraud. I heard just recently that the government of Turkey is also looking at making use of the track and trace data to detect and go after tax fraud by different entities in the supply chain. So that'll be interesting, and we'll see if that spreads around the world. Okay, I do have more questions. I also have the names of the people who asked them. I promise to sit down and answer these questions in email to you directly. I guess the only other thing I would say is make sure you watch for the next regulatory update, and we'll continue this dialogue. Mirav?
Okay, thank you, Dirk. Thank you for answering the questions. I know many questions came in, and we are only slated for a half hour today. So all these questions are recorded. We'll be sure to send those questions with your contact information over to Dirk for him to answer and get back to you with complete answers as far as his knowledge. Before we close the session, we would like to take one more poll. Okay, which country would you be most interested to hear the next regulatory update on? And we've left the United States out, but that will be included. As you make your selection, please note our next regulatory webinar is slated for December 13th. That is also a Tuesday at 11 a.m. Eastern. We will be sending out emails, invitations to ensure that you have a form to register. Okay, let's close this poll. And okay, that's the board. European Union. There you go. Start writing.
Pretty clear. Love that. Love that. Very good. All right, everyone. Okay. Well, thank you very much for attending.
Thank you for joining. Now, before we let you go, please visit systech1.com or on social media on LinkedIn and Twitter. In just a moment, we'll conclude the session and share an evaluation survey that will appear directly on your screen. There's nothing for you to do. This survey should only take a minute to complete, and we do appreciate your time and feedback. The survey will also offer you an option to input additional questions you may have for Dirk or for Systech as a whole. As a reminder, you will receive a PDF booklet and a copy of this recording within the week. And on behalf of Dirk and Systech, thank you for joining us today, and have a great day.